It was great fun to hear some data from China in terms of how it relates to cardiovascular disease in the setting of diabetes. And one of the abstracts seemed to indicate that triglycerides themselves may be a predictor of new onset type 2 diabetes. And I think that's an exciting observation. Of course, we know triglycerides really relate to other components of the metabolic syndrome. And we weren't entirely clear how independent that relationship was between triglycerides and heart disease, but it was an interesting study that I think demands additional analysis and follow-up to see the importance of simply assessing the risk for diabetes by measuring fasting triglycerides. Additional work was really carried out in patients here in China that underwent a treatment of coronary heart disease by using sirolimus drug-eluting stent. And those patients with diabetes actually had a poorer outcome in terms of death from all causes and death from coronary heart disease. But of interest, the restenosis rate and the luminal dynamics that occurred subsequent to the PCI really wasn't any different in patients with diabetes and without diabetes. So presumably the death in patients with diabetes following PCI and the placement of a drug-eluting stent could not be attributed to the stent itself or any complications of stent placement. And I think this is an important study because the assumption that patients with diabetes always have greater risk is always assumed, but this study suggests that the PCI procedure itself did not explain the increased risk of mortality in the setting of diabetes and stent placement.